Jan Cotton had an exciting and adventurous 30-year career with Trans World Airlines until it ended abruptly 15 years ago.
When I was first diagnosed, I was devastated. I didn't know what I was supposed to do with the diagnosis for COPD. My mom had COPD. The last thing that my mom told me over and over again, Janice, please quit smoking.
Chronic obstructive pulmonary disease, otherwise known as COPD, is a chronic lung disease in which the airways become obstructed, making it harder to breathe. Typical symptoms for someone living with COPD include wheezing, coughing, chest tightness, and shortness of breath.
Wheezing and shortness of breath are my symptoms.
COPD is a progressive disease, meaning it gets worse over time.
The lifestyle changes that I've made in order to handle COPD have been drastic. The things that I used to do, I do them at my pace. Stay away from anyone that's smoking. I always carry hand sanitizer. I do fist bumps instead of handshakes.
Lifestyle changes can help to slow the progression of the disease. If you smoke, look into a smoking cessation program. Avoid triggers like secondhand smoke and other pollutants. An upper respiratory infection can worsen COPD symptoms. Yearly immunizations against the flu and pneumonia are available at Walgreens with no appointment and are covered by most insurance policies. Physical activity, pulmonary rehabilitation, a healthy diet, and managing your weight can help you breathe and feel better. Ask your doctor what's appropriate for you.
First and foremost is to quit smoking. Have an exercise program where I use my hand weights. On my treadmill there's a picture of my mom and also a card that says, "I walk for you, mother." These are my personal motivations.
There are also medications to help. Bronchodilators are used to relax the muscles around your airways. This helps open them and makes breathing easier. Long-acting formulas of beta-2 agonists or anticholinergics are recommended. They are considered maintenance therapies, typically used twice daily to minimize symptoms and maintain lung function.
I do use a long-acting bronchodilator. It lasts up to 12 hours.
Inhaled steroids are also often used in combination with bronchodilators, especially during flare-ups to reduce inflammation. If you've been prescribed a long-acting maintenance therapy, you should speak to your doctor before stopping these therapies.
Scheduling medication is one of the most important things that you can do with COPD. They should be taken at the exact same time daily, taken as your doctor gives them to you, and never skipping doses.
Bronchodilators can be inhaled using metered dose inhalers, dry powder inhalers, soft mist inhalers, or nebulizers. Some inhalers may be preferred, however they require deep breaths or breath holding. Anyone having difficulty with their inhaler should ask their pharmacist for help. Nebulizers are effective with regular breathing and can be used with rechargeable batteries. While older nebulizers were heavy and less portable, newer ones are more lightweight, with the average modern nebulizer weighing under 1.5 pounds. People who are taking long-acting beta-2 adrenergic agonists, otherwise known as LABA medicines, have an increased risk of death from asthma problems. It is not known if LABA medicines increase the risk of death in people with COPD. For people living with COPD, education is key to helping them play an active role in managing their symptoms and improving lung function. If they have any questions or concerns, they should talk to their pharmacist or doctor.
You need to get a pulmonologist or lung doctor. Get your family involved. You can work with the COPD Foundation. They're there for you. You may not have a support group. You may not have family, but they will become your family.
For more information about managing COPD, speak with your doctor or pharmacist and visit copdtogether.com. COPD Together can help by providing the resources and support you need. You can also find your online support community at COPD 360 Social.